Co-occurring disorders is very common with all our patients. It's really the norm, not the exception. So whether you're working with patients who have psychiatric disorders, over half of them are going to have substance use problems. If you include tobacco, 3 out of 4 of them are going to be addicted to cigarettes or other forms of tobacco. On the flip side, if you look at substance abusers, they are going to have high rates of co-occurring disorders, particularly mood disorders, depression, bipolar disorder, personality disorders, also anxiety disorders like histories of trauma. One has to be also look for personality quirks that maybe not disorders, but will impact the way they interact and relate to other people. Polydrug abuse is a big problem for all the patients who come to a substance abuse problem. It's the norm, again, to be using more than one substance. Most patients who are alcohol dependent also are cigarette smokers. It's important to really address both at the same time. You may choose as a goal, just out of tradition, some addiction programs delay treating cigarette smoking. I personally would advocate for addressing them all together. At least address it somewhere in the recovery time period. People who come to treatment with an alcohol use disorder often have other substances. They may be using prescription drugs, tobacco. They also may have psychiatric comorbidities, particularly mood problems, personality quirks. I think it's important that a comprehensive program really assesses all those issues, includes that in the treatment planning, decides how to prioritize which of these treatments first. For alcohol use disorder, again, it's very common to have co-occurring other substance use disorders. Also common to have mood disorders like depression, anxiety disorders, personality disorders or personality quirks. Also medical comorbidities is particularly, if not right away in treatment, but usually later in treatment, where there'll be other issues with the liver or the heart. Similarly, with opiate addicts, you have the most common are going to be mood disorders and problems, maybe subthreshold disorders where they don't quite meet criteria, but it will be disturbing, and part of the problem of in early recovery is their brain is unpickling from the cucumber, from the pickle to the cucumber. Also, they're going to have anxiety disorders, history of trauma, and also personality issues. Any type of environmental toxin like substances has the potential to affect different parts of the brain, both in a damaging way as well as just altering the way the brain talks to itself. Also, neurobiological changes with psychiatric disorders. Those start from the genes and proteins and cells and evolve to different areas of the brain that would be altered. So it's important in the recovery process to also know that good psychotherapy, good treatment will also change the brain in a healthy, positive way.